Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association. It's been an eventful week this week in dentistry across the UK, and here's my roundup of the key events that happened. This week, our chair, Mick Armstrong, gave evidence to the House of Commons Health Select Committee, which is looking into the impact of the pandemic on England's healthcare services. We presented the case for dentistry and the damaging effects on both NHS and private care. Mick told the committee that the impact on oral health has been catastrophic, with something like 8 million courses of NHS treatment cancelled nationally, with thousands of practices being replaced by around 500 urgent care centres. They've done an excellent job, but obviously could never replace the full range of services previously provided. On a positive note, on the back of the evidence, Committee Chair Jeremy Hunt promised to reopen the committee's inquiry into dentistry, which had stalled in December due to the general election. So we certainly welcome that and will be contributing to ensure your views and needs are represented. This week, we also launched a petition to extend business rates relief to dentists. This is another part of our ongoing campaign for private practices to receive fair and equitable financial support during the crisis. So please sign that petition and you'll find the link underneath the video. Also this week, we received confirmation from discussions with NHS England on important issues relating to ongoing payments of associates and employed staff, and that includes pay during self-isolation. If you haven't read our FAQs already, again, there'll be a link underneath this video. Yesterday, the Department of Health confirmed the new timetable for dental recovery in Northern Ireland. 29th of June is the date when phase 2 will begin, and that's when non-urgent care can resume. Meanwhile, phase 3, which includes aerosol generating procedures, will commence on the 20th of July. However, there's also a fast-track option available for practices able to demonstrate that their key conditions around infection and prevention control are met. Acting CDO in Northern Ireland, Michael Donaldson, also committed support for practices in accessing PPE, and that follows our lobbying on this issue. And we're now pressing for more details, and we'll update you when we know more. PPE, obviously a huge issue, but of course we also know how essential financial support is in keeping practices afloat during this recovery period. And we are continuing to press the issue in our ongoing discussions with the Northern Ireland government. It's a busy day yesterday. We also received confirmation in Scotland from CEO Tom Ferris that on Monday the 22nd of June, that's this coming Monday, NHS and mixed practices in Scotland can reopen for urgent care using non-aerosol generating procedures. The phased reopening is in line with the Scottish Government's overall cautious approach to easing lockdown. Practices have been referring to the SDCEP guidance for several weeks now to prepare for reopening. We also plan to issue a Scottish version of our BDA toolkit next week to complement that advice, so look out for that. A limited supply of PPE will be provided to practices, and the current NHS financial support package will also remain in place for the time being. However, costs will inevitably rise as practices reopen, and we have expressed concern that many may struggle to open, both NHS and private. We'll be monitoring the situation and we'll continue to raise our concerns with the Scottish Government. Lots of blogs on the website this week covering these important developments across the devolved nations, including what BDA Wales is doing for members at the moment. So look out for those. PPE and fit testing particularly seem to be on every dentist's mind right now, so we've got a lot of information to keep you informed on those issues. If you missed our webinar on the use of respirators in dentistry, it's now available to view online. We've also got a blog by Tariq Shembesh, the dentist who's leading the fit testing programme in London's urgent dental care centres. Tariq outlines 10 things that you need to know about PPE fit testing. We're also expecting some news this week from NHS England on support for fit testing across general practice, so we'll keep you posted on that. Finally, the latest version of our toolkit has gone live today. It's been updated with essential information on face masks for all staff, ventilation measures, fit testing and BDA indemnity, and fallow time after AGPs, and you'll find the link for that content below the video. You might not be aware that our president, Ros McMullen, has spent some of her time since the outbreak of the pandemic working in a hospital in Northern Ireland to help support the mental wellbeing of frontline staff. Ros has spent many years of her career working to raise awareness of mental wellbeing in the dental workforce, given the intense levels of pressure and stress that we know dentists face, and something that has clearly been exacerbated by the current situation. Ros has written a blog in which she discusses 3 ways to mitigate stress at the moment, and next week she's holding a webinar called Understanding Your Wellbeing in a COVID-19 World, and that will be held next Thursday, 25th of June at 7:30 p.m. You can register for the webinar and read Ros's blog by following the links underneath the video. You may recall that we instructed law firm Brown Rudnick to review the wide range of business interruption policies held by our members and to provide legal advice for the dental sector. We held a webinar earlier in the week with partner Ravi Nair from Brown Rudnick to discuss that review and to outline next steps. So if you missed the webinar, recorded videos are available on our website. And that's all from me this week. I'll be back to update you on all the news in dentistry next week. In the meantime, have a safe and healthy weekend.